Hey guys, so today we will discuss some more ECGs. This is the first one. In this we can see that there is this ST depression with T wave inversions with a U wave. Okay, so this is ST depression, this is inverted T wave, and this one is a U wave. Clear? So this points towards hypokalemia. What are the ECG changes of hypokalemia? In hypokalemia we have ST depressions, we have T wave inversions, and a U wave. Along with this we have pseudo QT prolongation or QU prolongation. Okay. So what happens that there is this ST segment with inverted T wave and a U wave. The QT segment appears to be prolonged, but actually it is a QU segment which is prolonged. So we call it as pseudo QT prolongation. So we can see that the ST segment depresses in hypokalemia, while in hyperkalemia there is ST elevation. Clear? This is the second ECG. In this we can see that there is a regular rhythm. Okay. These two QRS or the PQRST waves appear in doublets. So there is a pattern. Now, as we can see that this is a normal P wave, this is a normal QRS and a normal T wave. Again, this is an inverted P wave, normal QRS and a normal T wave. Okay. Again, this is a normal P wave, normal QRS, normal T wave, inverted P wave, normal QRS, normal T wave. As you can see that there is one normal P wave followed by normal QRS and a T wave, and an inverted P wave followed by a normal QRS and a T wave. So this inverted P wave is the ectopic. We call it as premature atrial contraction. So there is a normal P wave, premature atrial contraction, normal P wave, premature atrial contraction. This is a pattern. This is known as atrial bigeminy. Clear? So it just like ventricular bigeminy, we have this atrial bigeminy. This is the third ECG. And this we can see that this is a normal QRS, this is a normal QRS, this one is a broad QRS. As we have discussed that the causes of broad QRS are bundle branch blocks, VPCs, and VT. So this one is not followed by a P wave. So this is a PVC. This is again a PVC. This is again a PVC, and this is also a PVC. Clear? Now, fourth ECG. In this we can see that there is this tall T wave. Now, what is a tall T wave? The T wave is more than 5 mm in two continuous limb leads, more than 10 mm in two continuous chest leads, or more than half of amplitude of QRS in two consecutive leads. Okay, so this is definitely a tall T wave. This is a broad QRS, as we can see that there is 1, 2, 3, 3.5 small squares, and there is no P wave. So absent P wave, tall T waves, and broad QRS. All these points towards hyperkalemia. So this is a ECG of hyperkalemia. What are the ECG changes in hyperkalemia? Tall T waves. Then there is absent P waves, followed by broad QRS, and finally sine wave pattern. Broad QRS is also associated with ST elevation. Clear? This is the fifth ECG. In this, we can see the heart rate is almost 300 by 1, that is 300. So this is definitely a tachycardia. As you can see that the QRS duration is almost 4 to 5 small squares. So it's a wide complex tachycardia. Now we have two differentials for wide complex tachycardia. One is VT, another one is SVT with aberrancy. To differentiate between VT and SVT with aberrancy, we have to apply Brugada criteria, which we will discuss later on. But one thing you have to know for sure that any wide complex tachycardia with hemodynamic instability should be treated as VT until proved otherwise. Again, this ECG is showing broad QRS, occasional broad QRS. This is a normal QRS, and a broad QRS. And we can see that there is a pattern: normal QRS, broad QRS, normal, broad. So every third QRS is a broad QRS. And the cause of this broad QRS is VPCs. So this is ventricular trigeminy. Clear? This is in another ECG. In this, we can see one that the rhythm is irregular. Okay? The rhythm is irregularly irregular. This RR interval is different, this is different, this one is different, this is different. Okay. The rhythm is irregularly irregular. The causes of irregularly irregular rhythm are atrial fibrillation, MAT, and atrial flutter with variable AV block. Here, as we can see that there is three different morphologies of P wave here. One is this, another one is this, another one is this, then this. So since there is more than three different morphologies of P wave, this is a case of MAT, that is multifocal atrial tachycardia. And the cause of MAT is generally COPD. Thank you very much, guys. So we'll continue this series.